Okay. I'll go. Hi everyone. So my name is Nicole Aquino and my partner is Helen. And we are presenting cost based on level of care and home health care. So there's different types of care. I included a bunch. I included long-term assisted daily living care, home health care, home care, hospice, and palliative care. There's also acute care, and in acute care there are 3 levels: primary, secondary, and tertiary. And in primary, it's like the first level, and that includes the physician offices and hospital and emergency rooms. And with secondary, it's next level, which is like surgery and internal medicine. And tertiary is the final level, and it's the most extensive, and that includes traumas and ICUs. So for payments, it's for that kind of care, it's Medicare, and it's responsible for covering those who are over the age of 65. And there's Part A, Part B, Part C, and Part D. And Medicare will cover certain types of care. So for Part A, it covers coverage over the hospital and skilled nursing facilities and home health services. Part B is over physician services and durable medical equipment. Part C, Medicare Advantage, and that's a combination of A and B, and it also has some additional benefits to it. In Part D, that's coverage over prescription drugs, and there's an additional amount that you pay through the premium through your private insurer.
Okay, under Medicare Part A, one admission or what is called a first spell of illness, Medicare can cover up to 90 days on inpatient hospital care after paying the $1,260 deductible. That's the rate in 2015. The copay for the first 20 days is $0, but after the 20 days, it's $315 copay for each day from I think I wrote that wrong. It says 61 to 90, but I think it's 20 days to 61. Oh, I need to look that up again. The hospital stay using Medicare after the 60 days has a high coinsurance. This is after you have a 60 reserved days, not just for that one spell of illness, but during your lifetime. If you're under Medicare, you can apply these days towards other hospital stays. And for the days 91 and beyond in the hospital, you will pay $630 per day for each lifetime reserve day until the 60 days over your lifetime. And then after that, you pay all the cost. These only for those who are in Medicare. Skilled nursing facility care is allows a patient to recover after a hospital stay under a physician's direction. Medicare does not pay for long stay in a nursing facility. Medicare will cover skilled nursing care for a maximum of 100 days. Medicare pays in full for the first 20 days, and from the 21st to 100th day, a copay is $157.5 per day in 2015. After that, you pay all the costs of your skilled nursing facility. I think this is one of the prices that's difficult to take where skilled nursing facilities are having difficulty in keeping only Medicare patients. So some skilled nursing facility, they have a balance of Medicare patients, and then the rest are private pays. Any long-term care after 100 days are not included in ACA or in any other healthcare plans. Long-term care insurance can be purchased. It's a separate kind of an insurance. Nursing home ranges, the price per month is The cheapest I've seen is in Ohio for $2,859, and over at New York at $32,850. That's just a monthly average for those states. For home health care, if you're recovering from an illness or an injury, for example, a knee replacement, you finish the hospitalization, you don't need a skilled nursing facility, but you need home health care. For example, you need regular lab draw because you're in a blood thinner, or you need to see a physical therapist because you cannot leave the house, but you want to recuperate at home. Home health care usually happens, and it's under the direction of the doctor. Medicare Part A pays for the nurses and therapists for that services. As long as the provider is certified by Medicare, you pay nothing. The 20% of the Medicare approved amount for durable medical equipment like wheelchairs, walkers, those are appropriate and Medicare covers. Hospice care are for those end-of-life stages, terminally ill, given at home or in a facility. Medicare Part A covers most of the drugs, the medical and support services. It's a short stretch, for example, in hospice facility to manage pain and other symptoms like cancer patients. They can be hospitalized briefly. They can also get respite care, so their regular caregiver can get a break, but that has to be in a facility. A copay prescription for outpatient drugs for pain applies, and also 5% of the approved amount for inpatient respite care services. And what we have cited as examples are mostly from Medicare. Insurances, once you purchase from the insurance exchange, they have something similar like that. So you have to weigh the benefits on which one you or your family need, and you purchase from there. And Medicaid, for example, a lot of the states covers the difference between the Medicare and the need of the patient. All right, so this is yours, sorry.
Oh, no, it's okay. So with hospitals getting paid, as you can see, like instead of length of stay in hospitals, or most states and insurance plan and employer health or hospitals, they go by the diagnosis-related group. And so payments by diagnosis-related groups, they encourage access to care, rewards efficiency, improves transparency, improves fairness by paying similarly across hospitals for similar care. And with the payment, it also makes the process easier, and it also helps with the administrative efficiency, and with basis payments on patient acuity and hospital resources.
I have inserted in here some example within where I live. 3 hospitals who had charged, well, the averages for the same diagnosis. For example, Kaiser's and HMO is $25,000 for pulmonary edema, while Sutter, it's a pretty big hospital around, and it's 68,000. While North Bay, it's their easy access hospitals, it's almost 140,000. So different hospitals has different, they charge differently. It's according to, I guess, the presentation of the patient. A lot of the hospitals, they try to prevent a lot of conditions because they know the insurance will not reimburse, such as falls, pneumonia, decubitus ulcers, and other related conditions and infections that can be acquired from the hospital.
So with cost based on level of care, so definitely higher levels of care result in the higher payment. And so there's like fee for service, where doctors and healthcare providers, they're paid on the type of service they perform. And so with costs based on level of care, physicians and healthcare providers are about to receive with more money based on the procedure they provide. Those who research and critique the system, it's no wonder that healthcare costs have skyrocketed in recent years. And so with physicians getting paid with Medicare, you need to pay the Part B annual deductible. And then after you meet the deductible, you pay Part B, the coinsurance for the covered Medicare services. And for doctor's visits, you typically pay the 20% coinsurance of the Medicare approved amount for the care that you receive. And so with the ACA, doctors are credentialed by hospitals and they have agreements on rotations and time commitment. And so with providers, they're paid their base pay, and then cash bonus are profit sharing. And then the specialty doctors and surgeons and covering doctors, they get paid the fee for service, which was getting paid for the certain amount that they provide. And so admitting doctors who have more accountability and responsibility, they get paid by a fee schedule. And since the ACA maintains the preventive or routine physician visits are free for patients, they do have limited reimbursement for the providers. And clinics, they do now ask if it is for a previous case or a new symptom. Here we included states that are working on healthcare innovation and moving away from like free or fee for service type systems. And so with the ACA affecting levels of care, their healthcare providers are being paid for the quantity of the service they provide. And so they're starting to move away from that system, as you can see in the last slide with the statistics. And so since they're going to shift the payments to a system, it's going to provide reimbursement and payments to the healthcare provider based on the value of the service instead of the amount of the service being provided. And on the CMS website, it said that the ACA is currently working on initiatives for bundled payments. The Bundled Payments for Care Improvement Initiative is comprised of 4 broadly defined model cares, which link payments for the multiple services beneficiaries receive during an episode of care. So bundled services are services that everything is covered within that service instead of, so it includes like your hospital stay and your recovery and stuff like that. And so with the ACA, there's many people affected by it, and it's typically the healthcare providers because they will lose money by being underpaid for performing certain services. And then we interviewed a nurse, and she said fee for service is a positive system for them. Being paid for the service you provide is deemed acceptable by us. The ACA is extremely strict, and if forms are not filled out correctly, then the ACA cannot reimburse the hospital. And then so moving on to home health care. Home health care is a wide range of healthcare services that can be given in your home for an injury or illness. And it's typically less expensive and more convenient, and it's effective as the care you get in a hospital or skilled nursing facility. And home health care is different from home care. And some of the services that are provided by home health care, they take care of like the wound care and patient caregiver education, nutrition therapy, injections, monitoring serious illnesses and unstable health status, and being seen as often as the doctor has ordered for the patient, and monitoring of health and reporting back to the doctor. So all ages can qualify for home health care as opposed to like hospice care. And so the qualifications for home health care are based on your level of need. And typically older Americans who have health problems, but they want to maintain their independence in their home with the support of a caregiver. Patients of all ages who return home from surgery and need care, supervision, or assistance. And patients who have complex treatments that require use of medical equipment and or medication monitoring. It goes on and talks about mothers and newborns and young adults and mentally ill adults and adults who want their parents to have quality of care, and those with chronic diseases and disabilities. So the payments for home health care is typically Medicare or private insurances or health plans from employers. Medicare is the number one payment for this system. I was able to interview a home health care nurse, and we talked about what they do on a daily basis, and they talked about how they just do things such as just completing assessments and making sure that they're okay and that they're doing as the doctor orders, and checking medications and wounds and stuff like that. And they just create a plan and plan to visit them and just evaluate their progress on how they're doing. And when it's time for them to be just discharged from their service, they do that. They talked about how they take care of patients typically from ages 19 and up, but that varies on their location. And so with difficulties with payments, such as Medicare with them, and how it affects the ACA affects their work, they were talking about how typically they don't deal with the payments directly, but it's important to chart properly because if they visit the same day as the doctor, then they don't get paid, or you can't double charge. Some of the difficulties they were talking about with home healthcare service that they face is that patients typically aren't compliant with their service. So sometimes they just don't pick up the call, or they just aren't taking their medications properly or listening to what the doctor wants them to do. And they also talked about how as time goes on, home healthcare will continue to advance and increase. And this definitely just isn't a trend of right now. It's going to keep coming. And we left with some advice, and they said that the number one advice they have to get into this line of work is to just have experience in acute hospitals for over a year or more, and just have the desire to do the job because it's so much more different and a different kind of responsibility than regular hospital work. And then we just left with some stats with like the number of home health agencies and the portion of agencies with profit ownership and the number of patients who received and ended care for home health care during the year of 2013. And this is for the entire United States. This isn't just specifically for one state. And that's it.
All right, thank you.
Thanks. Okay. Come on.
Yeah, you can post it. I don't have to change that. The first slide that oh, sorry.
Okay.
Yeah.
Okay, stop.